Hey guys, it's Linda, and I am going to talk to you guys about medicine and the pediatric patient. The topics we'll discuss are physiological elements that make the pediatric patient different from the adult, dosing strategies in pediatrics, febrile seizures, and sports physicals, and do not miss findings related to those sports physicals. So, physiological differences. There are 7 key points to consider when thinking about the differences between children and adult patients, because children are not just little adults. First, they have a larger body surface area, or BSA. This translates into the easy loss of heat in their body and also the increased absorption of toxins on their body. Kids, the smaller the kid or the patient, the greater ratio of surface area skin to their size. Speaking of skin, kids also have thinner skin. This increases their skin absorption and things that are put on their skin, like medications or toxins. Another thing about kids is they have rapidly dividing cells because they're growing. Their cells are always dividing, so this makes them more susceptible to radiation. That's why we have to really think about doing x-rays or subjecting kids to any kind of radiation when they're young. Another thing about kids is they have a higher heart rate and respiration rate. So this comes into play when we think about pulmonary agents, um, medications that we give via inhalation or just um, their susceptibility to things that are in the air, allergies, smoke. Another thing about kids is they have an immature blood-brain barrier, so anything that affects the central nervous system is going to affect kids a lot more than they would adults. Kids also have higher metabolic rates, so they metabolize food, water, and medications a lot faster than adults would. So contaminations in food or water, medications. They also are more prone to dehydration and loss of water during illnesses compared to adults. And lastly, they have immature immune systems, meaning they're more likely to get infections because their body they haven't developed the antibodies in their body to fight off infections as an adult would. This is a little picture that kind of will help you guys remember 7 different things about kids that make them different from adults. That kind of ties into pediatric dosing strategies because when we give meds to kids or to pediatrics, it's a lot different than giving medications to adults because for kids, usually medications are based on their weight or body surface area. Their dosages are much smaller than adults, and accuracy is really important for kids because there's a smaller margin of error for them because they're really sensitive to medications and they're smaller. So there are a few different causes for medication errors for pediatrics. The first one is using an adult formula versus a pediatric formula. Another is there's multiple concentrations for pediatric formulas, so that causes confusion for people. And then improper parental education. Sometimes we're just not educating parents enough or correctly on dosaging or administration of medications. Another thing is inaccurate measuring devices. Either we or parents aren't using the correct devices to measure medications for kids. Instead of using a syringe or those little dose cups, they use a teaspoon or a spoon they have in their drawer. It's not the same, it's not comparable. And lastly, calculation errors. Sometimes it's just a math mistake that we make. So it's really important to double check our work when giving medications to kids. These are just a couple flyers that I found. This is a good one to give to parents to avoid medication mistakes, to tell them about why it's really important. And the other flyer is clear dosages, clear dosage guidelines for kids for acetaminophen and ibuprofen, and it kind of lays out what weights for kids and what are the dosages for those weights. These are two commonly given medications to kids. And those medications that we give them for are usually for their fevers. And fevers can cause febrile seizures in kids. So a febrile seizure is seizures associated with fever, absence of other defined causes. There are 3 types of seizures that are febrile. These include simple seizures, which are 90% of the seizures that happen in kids. It's less than 15 minutes long, it doesn't have any focal components, and it only occurs once in 24 hours. Second, there are complex seizures. These are medical emergencies. They last longer than 15 minutes. There's multiple in 24 hours, and or there are focal features. Lastly, there are symptomatic seizures, and this occurs when there's pre-existing neurological abnormalities in the child already. So common complaints with febrile seizures include fever, general tonic-clonic seizures greater than 5 minutes, staring and loss of muscle tone, or staring and muscle stiffness and rigidity. Other signs and symptoms that can include febrile seizures include altered state of consciousness, vomiting, and decreased feeding. So a little bit more information about febrile seizures. 2 to 5% of the population are affected by febrile seizures, and this usually occurs between the ages of 12 to 18 months. They are associated with vaccinations, including MMRs, flu vaccine, pneumonia vaccine, and Tdap. Family history of seizures are also associated, and previous febrile seizures. For the febrile seizure to be considered febrile, the kid has to be over 105 degrees Fahrenheit, but most likely occurs over 102.2 degrees Fahrenheit. And they can also occur with viral and bacterial infections. So when assessing a child during febrile seizures, there are certain things you should look for. For subjective data, you want to ask if there was a fever during the seizure, what was the state before the seizure, what happened during the seizure, what was the child's state after the seizure. You want to ask some other symptoms, including nausea or vomiting or diarrhea. You wouldn't be able to tell if the kid was nauseated. What treatments they tried, has this occurred before, their medical history, their developmental history, their family history, and if there's any current illnesses in the family or daycare setting. During their physical exam, you want to note the child's overall appearance, how they're breathing, how they're crying, if there's any bulging fontanelles, depending on the child's age, if there's any pachea, the tympanic membrane, assessing for sinusitis, nasal flaring. For the oropharynx, you want to see if there's any dry mucous membranes, if there's any erythema, or if they have large tonsils. You want to see if they have any neck rigidity, lymphedema. You want to listen to their heart and their lungs. You want to palpate for any abdominal masses or tenderness, and of course, do a complete neural exam. For diagnostic testing, you want to check their O2 stat, their CBC, glucose, and urinalysis. If there are neurological signs, you may want to do a lumbar puncture and an EEG. If the seizures last more than 5 minutes, it's a good idea to check electrolytes and blood sugar. And you want to do a chest X-ray if there's any respiratory issues, or a stool sample if there was diarrhea during the seizures. So things you can teach the parents and family related to febrile seizures. You want to reassure parents that there are no neurological, intellectual, or behavioral impairments that occur with seizures. And if they do occur, they're very rare. You want to tell them that during a seizure, you should lay the child on their side to prevent aspiration, that they don't want to restrict the child's movements, and you shouldn't put anything in their mouth. The time of the seizure, Timing the seizure is very important because you want to know how long it lasts, and you never want to leave the child alone when they're having a seizure. You want to tell them that medications that bring down the patient's temperature are ineffective to prevent seizures, but they do want to give ibuprofen or acetaminophen for temperatures over 104 degrees Fahrenheit. Therapies that are generally used to prevent seizures in other kids are not effective and not recommended for febrile seizures. And lastly, but most importantly, if the seizures last longer than 15 minutes, they need to call 911 and it's a medical emergency. So follow up for these patients. They want to follow up with any subsequent seizures and as needed. So when to refer out. You want to refer them to a neurologist if the seizures are uncontrolled or they have repeated seizures. And you want to send them to the ER if you can't rule out meningitis. Okay, our last topic is sports physical examinations. Sports physicals are required for kids before they participate in sports. So this should occur every year and it should be done several weeks before they start these sports. The goal for these sports physicals is to make sure the kid is safe for their specific sport. You want to check for their growth, development, maturity, and their size. You want to observe for any congenital or new anomalies or conditions. You want to assess their personal risks of participation in this particular sport, and you want to help them to eliminate any barriers that will prevent them from participating in sports. So there are 4 forms that you can use for your H&P exam on www.aap.org. So sport physicals, you want to check the normal things like vitals, vision, dental, physical exam, musculoskeletal exam, nutrition, flexibility and strength, speed, agility and balance, medical history, review of systems, and then you can clear the patient 2 ways. The first way is clearing them for all sports without restriction, or you can clear for all sports without restriction with further evaluation or treatment for a particular condition that you're diagnosing them with. So most importantly, during your sports physicals, you want to make sure you ask these and do not miss these findings. So a big one is dizziness or syncope because it could be a cardiac finding and you want to make sure the kid doesn't have any cardiac issues. Next are heat illnesses. If the kid has any history of heat illnesses, you want to teach them how to prevent it and assess their risk for having another heat stroke or heat illness. You want to assess for their family history if they have any family history of exercise related to death or MIs that occur when they're younger than 50, you know. You want to see if they've had any previous injuries, illnesses, fractures, or traumas, if those are completely resolved and healed and will not cause the kid any further issues. Kids can be disqualified from participating in sports for a number of reasons. These include dizziness with exercise, if they have a history of asthma, especially if it's uncontrolled. You want to make sure they're on medications and they know what to do. If they do have an asthma exacerbation, you want a musculoskeletal abnormality can also disqualify kids. Heart murmurs, visual impairments, elevated blood pressure, or a high BMI, or a combination of any of those things. Definitely important to look for. Yeah, that wraps up our talk today about pediatrics and medicine. So if you have any questions, just shoot me a text or email me. Okay, bye.